everybody. Welcome back to the Mindful of You podcast. This is episode 58, All Things Therapy with Michelle Pesnell. Y'all, I am so excited for you to listen to this particular interview. Michelle is amazing. I have loved chatting with her about her experience being a therapist. And this episode, she shares a lot of wonderful things about what to expect in therapy and also some tips to get you and I feeling better right away. So, a little bit about Michelle. Michelle has a bachelor's degree in social work from Weber State University and a master's degree in social work from the University of West Florida. She has been doing therapy for almost 2 years and loves spending time outside hiking, gardening, and being with nature. So, without further ado, here is Michelle. Hi, Michelle. Welcome. How are you?
I'm good. How are you doing?
I'm doing great. Thanks for asking. Thanks so much for being willing to come on today.
Yeah, happy to be here.
Awesome. Thank you. So I posted a poll on Instagram for what we should chat about today. And I have never seen a poll get such even votes in my life. So everybody voted for different things. So I was like, well, let's just talk about pretty much all of it. So that's what we're going to do because people seemed really interested in what you had to say about a few different topics. So um, we're just going to dive in with our first question here. And this is one I'm really interested in. I've been wanting to talk to you about anyway, but tell us more about what interested you in becoming a therapist. And then I'll have a follow up question for that. But tell
Okay.
us more about that.
Um, well, I wasn't really interested in doing therapy until I started doing it. So I
Okay.
was doing social work and you have to do an internship. Um, and honestly, just kind of the easiest, most accessible internship for me was to do therapy. So that's what I chose, thinking like, oh, it'll be good experience, get my feet wet with therapy, have that experience, and then I can go do what I actually want, like work in a hospital or a residential treatment center or something like that. But then I started and found that I love it and I love my clients. I love the field of mental health, and that's something that a lot of social workers go into. Um, and I just kind of fell in love with the one-on-one. I didn't think I would like the one-on-one, but
Uh-huh.
I have grown to really like it.
That's awesome. That's awesome. And you touched a little bit on this, so it sounds like you got a degree in social work. So how did that work? Being in social work and doing therapy, is it a pretty seamless transition there?
Yeah. So
Uh-huh.
I started with a bachelor's in social work, and to, for lack of better wording, I guess, to really make money in social work, you should probably get a master's degree.
Yes.
So
Yep.
I then went to go get my master's in social work, and you have to do like a graduate level internship. Um, so I started doing therapy as mine, and I had a lot of classmates that were doing tons of different things, like working in a hospital, at a school, at residential treatment centers. There was just a lot, but it's pretty seamless transition because in graduate school for social work, they kind of anticipate a lot of students becoming like mental health providers,
Mm-hmm.
um, whether they're like a crisis worker or a social worker at the hospital or a therapist. And so a lot of our course materials kind of just seamlessly fed into being a therapist. So,
Okay. Very cool. That's awesome. And what initially interested you in doing social work then? I know you kind of ended up just pivoting to therapy, but what um, made you interested in social work originally?
yeah, so I always wanted to do something to like help other people. Um, And so I got all my nursing prerequisites done because I thought, oh,
Uh-huh.
that's a good route to go, right? Just like logical, like, oh, I can make
Yeah.
money, I'll be at a hospital, pretty good setup. And then I kind of like panicked and was like, wait, no, I don't actually want to do this. So I just took like, I think 4 or 5 different like intro classes in college. I just picked a semester and I said, I'm just going to take everything I can think of I'm interested in. I did like engineering and teaching, and social work was one of them. And I can't remember the other. Um, and I just kind of fell in love with social work, like just that 1010 course. The
Wow.
professor was awesome. We got to learn about what social workers do, but really what drew me to it the most, I would say, is the flexibility. Like social workers can be almost anywhere.
Yeah, that's true. That's very true. Okay, awesome. Thank you. So one of the options on our poll that was pretty popular is I didn't realize, but it sounds like a lot of people who follow this podcast or at least follow my Instagram actually haven't done therapy. I think because I've done so much therapy in my head, I'm like, everybody's done therapy, but that's not true.
Yeah.
So a lot of people were just curious about like what therapy is even like. So can you tell us what a first appointment is like for you and a client?
Yeah. So our first appointment, it's called an intake because we just kind of set the stage, right? So um, a person walks in, I say, hi, nice to meet you. What brings you to therapy? Um, we go over paperwork because you have to fill out paperwork before your intake appointment. And so I just kind of go over their paperwork. And our paperwork, I like it, is pretty comprehensive. So it just kind of, they check off all the symptoms they're experiencing, um, kind of their strengths, their weaknesses, what they'd like to get out of therapy, the reason they're coming to therapy. So I just kind of follow the intake form and I say, okay, so it sounds like you're experiencing this symptom. Tell me more about it. Sometimes I'll just ask them to give me like a history on their life. Like, okay, like tell me what life like was for you growing up and kind of what brought you here today and stuff like that. But it's usually just a lot of get to know you, get to know why you're here.
Okay, very cool. And what types of reasons do your clients usually give you for having come to therapy?
Um, for me, mostly, I would say anxiety, depression, and parents bringing their kids who are struggling with like behavior concerns, struggling in school. They've got ADHD. They are acting out. They're depressed, self harming, whatever it is, right? So, parents concerned about their kids or people who have anxiety and depression.
Okay, cool. And do people usually come in with like a referral from a doctor, or is it a mix of both? Like, do you see people who are just like, I just thought I should talk to a therapist because I'm feeling anxious, I'm feeling depressed? Like, what's the norm?
Yeah, I see a little bit of everything. So,
Mm-hmm.
our agency does psychological testing. So, people who are maybe curious about their mental health and they go get psych tested to see their diagnoses. Um, then, at their like psych workup, kind of the finished result of your psych testing, a lot of them will be recommended to therapy. So sometimes I get referrals from psychologists. Sometimes people go to their doctors and say, like I'm depressed. I'm maybe looking for treatment, and then they'll be like, yeah, go see a therapist. Um,
Okay.
but a lot of the times, I would say people just kind of self refer, so they just come on
Yeah.
their own.
Yeah. Yeah. And I think that's an important point because I think that there might be misconceptions out there like you have to reach like a certain level or have an official diagnosis to go to therapy, but it sounds like that's not the case.
Yeah, definitely not.
Okay. Cool. Um, Following up with that, when do you think somebody should consider going to therapy?
Well, I think that everybody should go to therapy.
I thought you might say that.
Yeah, it can be great for anyone, really. can be, I guess. It just kind of depends on the person. But there's lots of different types of therapy and therapists out there. Most people can find a good fit for them. But I would say when therapy is especially needed, and you should really consider it, is if your mental state, your emotional state is getting in the way of your everyday life. Like you're
Yeah.
struggling to go to work, to finish school, to get along with um, loved ones, kind of, when it's really impairing your daily life, that's when I would say go to therapy.
Okay, very cool. I completely agree with that. I know for me, like I've been in therapy like off and on, like because I did cognitive behavioral therapy off and on for a while, and now I'm doing exposure response prevention for OCD.
Hmm.
And so there's been different times in my life where I felt like, oh, okay, like it's ramping back up, like things are interfering with my life, and so like kind of a question slash comment with that, like do you usually have like long-term clients, or do you see that people come in and out, or is there a specified length of treatment for your center? Can you just tell me more about that? I know it's not one of our listed questions,
No,
but
that's okay. Um,
yeah.
yeah, I think it's different for everybody. Most of my clients that I do an intake with and start seeing, I would say, um, are there long term.
Okay.
They're there because therapy helps them feel better and they don't necessarily feel the need to leave. Um, a lot of the times I do kind of like a slow fade termination with
Yeah.
people. So I'll be like, you're
Uh-huh.
doing really great. Let's just see each other once a month.
Okay.
And then if they're still doing really great, I'll be like, let's just do a check-in like every couple months, right? And then after that point, we've hit that, I say, just come see me when you need me. Um,
Yeah.
and so I would say people generally stick around. If you get the right client therapist vibe, then people generally stick around
Yeah.
for a long time. But yeah, I would say it just kind of depends. Like sometimes I've had kiddos with anxiety. Um, and then we kind of treat their anxiety and they're doing a lot better. And so then I'm just like, hey, come see me when you need me, right? And it's been like maybe 6 months with them. Um,
Uh-huh.
but yeah, that's what I would say.
Okay. Okay. That's very interesting. And I realized this was a listed question. I had, what does a typical length of treatment look like? So it sounds like it varies is kind of the answer, and that um that maybe it just becomes less frequent that they're checking in with you.
Yeah, I would say it also depends on the kind of therapy.
Uh-huh.
There's tons of different types. Like some recommendations would be like, hey, this is an intensive program of therapy. Maybe it's like DBT or exposure response, um,
Mm-hmm.
or EMDR for trauma. And we say, all right, do this for a year, and we'll go from there. Usually, we don't give people like a set, hey, this is how long it's going to take you to feel better, because it really is just different for everybody. But I would say that um, it takes probably longer than you think for
Yeah. Yeah.
treatment, because progress is slow moving. You can't necessarily just fix something in 6 months and be like, okay, you're good, see you later. Sometimes you can, but I would say that's more of the exception instead of the rule.
Okay. Okay. And what kind of therapy do you usually use, or do you have more of an approach where you like pull from multiple styles? What
Yeah,
does it
so
look
I
like
do
with you?
kind of a pull from a little bit of everything, whatever my client needs.
Okay.
One thing I don't really do is trauma,
Okay.
just because I trauma can be tricky. And so I always recommend people, like, if you are coming to be treated for trauma or PTSD, see somebody who's like certified in either
Yes.
trauma
Hmm.
focused CBT or EMDR or something like that. just because it can be tricky and I don't want to re-traumatize people. Um,
Mm-hmm.
but I do some cognitive behavioral therapy,
Okay.
um, dialectical behavior therapy.
Can you tell me a little
Um,
bit more about dialectical behavioral therapy and a little bit about CBT as well, because other people might not be familiar with it?
yeah. Um, so CBT is kind of, I would say, I don't know if this is the right word, but like basic therapy. Like a lot of therapists use CBT.
Do
Um,
CBT. Mm-hmm.
yeah, it kind of just is all about challenging the way that you think, reframing kind of your thoughts and feelings. It focuses a lot on our thoughts and then our behaviors, how those are related, and how we can manipulate each of those. Um, and it's pretty broad. So technically, DBT, which is dialectical behavior therapy, is kind of under the umbrella of CBT.
Okay.
Um,
Okay.
and it's just a little more specific. It's all about skills. So there's a specific kind of curriculum for this
Okay.
therapy. And usually we do like group therapy with it too, which is called skills training.
Okay. Yes,
Um,
I've heard of skills training. Okay.
yeah, and it's really honestly DBT, it's a lot of acronyms um, to learn skills. Skills,
Okay.
yeah, skills to regulate emotions,
Okay.
to work on relationships and like communication, to it's called like distress tolerance, which is kind of like surviving a crisis survival,
Mm-hmm.
and mindfulness is our big core skill. Mindfulness is the bread and butter. So
Wow, I didn't even realize I was probably doing like some DBT because
yeah,
definitely I've done work with therapists on distress tolerance and mindfulness. Like those have been
hmm
heavy focuses. So
yeah.
interesting.
A lot of therapists use bits and pieces from kind of everything, right? And
Hmm.
so most therapists, I would say, are familiar with a little bit of DBT in some form.
Okay. And I kind of cut you off earlier because you said you pull from CBT, DBT. Was there anything else, any other theories that you work with?
Yeah, I do ACT, which is acceptance commitment therapy. Yeah, that's what it stands for. I do a little bit of that. It's kind of similar to DBT. Um, I and then I just kind of do honestly whatever my client needs. So if I pull from some, like I can do kind of minor trauma, I would say. I have some, obviously, a lot of clients have trauma. And so I have a lot of clients that do have trauma, and we kind of work on that with a little bit of like trauma focused CBT. Um, I've done some like exposure response prevention for OCD or phobias.
Hmm.
Um, and well, there was one other I was thinking of. Oh, yeah, like it's called REBT, which is basically just CBT. It's just like kind of a very specific skill of, I think it's called rational. Nope, I don't remember it. Rational
That's totally
emotive
fine.
behavior therapy, I think. But
Okay. Okay. I believe it.
um,
It sounds smart.
yeah, but it really is just kind of like, um, it's like tracking behaviors and thoughts and feelings connected to those behaviors so that we can kind of either change the behavior or stop it or whatever.
Okay, super cool. Thank you. This is the last question I'll spring on you about therapy, and then we'll move on to the last part of this. But I am just wondering what you feel like the client's role is in therapy. Like, what is it important that they know or do if they're either going to go to therapy, if they're currently in therapy, to help themselves get better?
I would say it's important for clients to put in the work. Um, some people can just use therapy as a place to like talk and vent, and that helps them feel better. They just need talk therapy and they're good to go. But most people, they need to put in the work. They need to be teachable. Um, and open to learning the skills and doing the homework that their therapist gives them, and really kind of just like, I would say teachable is the best word to describe it. Just open to change and willing to put in the work.
Yeah, yeah, I completely agree. And I think um, that's really helpful for people to know because I do think there's something cathartic about just going and talking with somebody, and that might be all somebody needs, but making changes and doing the work yourself is probably going to bring about some bigger change, it sounds like.
Yeah.
Okay, awesome. So the one of the options on my poll that was also really popular was people wanted to know like, I mean, we all want this, right? We want like quick fixes to feel a little bit better, and I know that that's not always the way, but we're gonna put you on the spot and see if there's anything that we can do that's small to start feeling better. So I've broken it up into some categories. So, what are some simple things that you think we can do physically to improve our mental health?
Yeah. I would say taking care of your environment. And specifically your body. Like we always say that like the brain follows the body and vice versa. And
Mm-hmm.
so if you are able to like balance your nutrition, your eating, um, really focus on getting good sleep, and incorporating movement into your life, because I don't love the word exercise, I like the word movement. Um, those
Yeah.
things really, like the importance of those can't be overstated. Um, it will just help you feel better in general and have more energy to actually then go put in the work, like deeper work, to focus on trauma
Yes.
or phobias or whatever. But yeah,
Yes.
I would say um, just kind of those little things: nutrition, movement, sleep, and also kind of like your environment. You can manipulate your environment a little bit to feel better, like simplifying um, like your household. I see
Okay.
that a lot with people, and particularly women, um, who have a lot of stress about their house and kind of like homemaking. And I would say just kind of like shifting your perspective on like things that need to be done a certain way and just making your life more functional. If that means
Okay.
like, um, it doesn't necessarily look pretty, but having a laundry basket in every single room in the house, if that makes your life more functional, I say go for it.
Yeah.
Reduce stress, right?
Absolutely. I love that. Something else my mother-in-law mentioned the other day is I think she'd seen like a post or like an article or something about a therapist who had told their client who was stressed about the dishes, like, why don't you just use your dishwasher? And she was like, well, I have to clean the dishes before I put them in the dishwasher to get all the gunk off. And they're like, well, why don't you just run it twice? And
Hmm.
like, she
Yeah.
had, or like, why don't you use paper plates? You know, like, there's also questions of, I know we care about the environment and things like that. But, like, there's usually solutions that might seem kind of like silly or like I can't do that, but it's like yes you can. You
Yeah.
totally
You make
can.
your own rules, right?
Uh-huh. Yeah,
Yeah.
I love that so much. And sleep is something when I was first starting my mental health journey, sleep, eating, and movement. I like that you use the word movement. I'm gonna have to steal that. Is like the first things that helped me feel better. Like you said, there was still more work to do after that. Like I
Mhm.
definitely still had thoughts and things like that that needed to be addressed. But if you're not sleeping and not eating and not moving, that's not great. And something I really liked that one of my therapists taught me is he's like, don't stress too much about eating nutritiously yet because I was struggling to eat at all. And it wasn't really like a body image thing, it was a depression thing. It was like,
Mhm.
I don't want to make food. I don't want to go out the door to get food. And so he was like, just eat something, anything. And he would even, like when he would DoorDash himself food, he would get me something, which was like above and beyond the call. But so that was like something that really changed it up for me. So I
Yeah.
appreciate the validation of knowing that that's something that's worked for you and your clients as well.
Yeah.
Okay. Awesome. So, what are simple things we can do for ourselves emotionally to improve our mental health?
I'm so excited for this question because my answer is practice mindfulness. Um,
Oh, I love it.
yeah, I'm really a big fan, big supporter of mindfulness, um, and kind of in the context of DBT, that dialectical behavior therapy, because we say mindfulness. Um, is not necessarily like meditation or yoga or things like that. Those things are mindfulness, but mindfulness is not like that.
Yes.
Mindfulness is like a
Hmm.
big umbrella of just living your life on purpose instead of on autopilot, right? Like paying attention to the moment, paying attention to your thoughts and your feelings, letting them exist instead of pushing them away. Um, participating in your life on purpose instead of just being a bystander. Um, I would say, honestly, just practicing mindfulness. There's lots of different ways you can practice it. People do like mindful eating, where you have to like really experience the um, the event of eating a meal. Like you smell it and you maybe touch it and then you chew it like 25 times and then you swallow. Um, you can mindfully brush your teeth, right? Like you're focusing on just the experience without letting your mind wander. I would say practicing things like that, where you have to focus your attention on the present, is a big way to help with emotions.
Oh, I love that. Well, and mindfulness is in my name, so that's pretty fun.
Exactly.
I I something I've noticed with mindfulness too is that it works for pretty much anything and kind of fits into all of those therapies techniques that you described
Yep.
because as a part of like exposure response prevention, as I'm trying to avoid doing compulsions, a lot of those things are mental or it's just really, really hard not to do it. And mindfulness is a huge technique of just staying in the present, like when I'm in the shower, like noticing like the soap in my hands and like noticing what I'm hearing and what I'm smelling. And I've taught those techniques before that have worked for me for panic attacks too. And so that's huge. I didn't expect you to say that for some reason, but that was like the perfect answer.
Yeah.
So I
And
love it.
another, I guess, hint or like FYI with mindfulness too is it can really help like symptoms of ADHD, um,
Okay.
because mindfulness helps increase our focus and our attention span. And like focus and attention span is a skill that can be improved, right? Some people, I have ADHD, I have a hard time focusing or concentrating. I can work on that. And I might not be as good as the person next to me, but I can get better at like my concentration and my attention span if I practice mindfulness. So,
Oh, awesome. If you brought up ADHD, I'm going to have to make my husband listen to this now.
yeah.
I love it. Thank you so much. So, any last tips on feeling better? And I'll add any last plugs for therapy for anybody who's on the fence about trying it.
Yeah. For feeling better, I would say my last tip would be like fake it till you make it. It's actually kind of a silly thing, but it works. It's like affirmations or something, like where I'm telling myself positive things. I might not believe it the first 100 times I tell it to myself, but it's building that brain pathway so that you will believe it one day if you stick with it. And I say that honestly for anything with like skills, building habits, feeling better, trying to be more positive, just kind of like fake it till you make it. one day you'll
Love
look
it.
back and be like, oh, wow, look at all this progress I've made faking it, right?
Yeah.
Um, and as for therapy, I would say if you're on the fence, just jump in, go take the leap and find a therapist. It's kind of can be a tricky process. You got to find the right therapist. I always tell my clients that therapist finding is like shoe shopping. You got to find the right fit. Some
Yeah.
work, but they're not the most comfortable. Some don't work at all. Some are kind of in the middle. You're like, like this works. It's maybe not the greatest fit, but I'm getting to where I need to go. And some you're just like, wow, this is the perfect shoe, right? The perfect therapist, and we vibe well. Because
Yeah.
the therapist-client relationship is very important. Um, so I would say don't let that scare you from attempting to go start therapy, because there's lots of therapists out there, and we as therapists, don't get offended if you leave to find a different therapist if it isn't a right fit, right? Like we know that we experience it all the time. So I would say just like, yeah, go for it.
Oh, I love that. I think I've had like 5 different therapists in my life, and I would say probably only one, maybe two, have been like the perfect fit. So
Mhm.
like doesn't mean like you can't make progress at all, but if you can find somebody that's at least that good fit, that you feel comfortable, that you can share things with, then that's a really good sign. So I
Yeah.
miss her. She lives too far away from me now, so can't see her anymore.
Yeah,
But
I had a
she
therapist that
was
moved
awesome.
too.
Ah, bummer.
Yeah.
Bummer. Why do people move? Well, telehealth is helpful now, but
Yeah.
not everybody offers that. So,
Yeah.
okay. Wonderful. Well, that's all the questions I had for you. This was huge. I always have to put the disclaimer at the beginning of every podcast. I'm like, I'm not a therapist. I haven't, received official training. So it's awesome to have somebody who is here, so that people can start implementing some of these tips. So,
Yeah.
okay.
I'm happy to be
Thank you
here.
so
So,
much. Thank you guys so much for listening. I hope you liked hearing from Michelle. I know I did. It helped me out a ton. So, tune in next week for more quick ways to start feeling better by focusing on 3 simple things: eating, sleeping, and moving. Hope to hear from you guys then. Bye bye.